So let's talk and focus on spinal surgeries. Spinal surgeries are very common. I've seen people have ones that are successful, ones that are less than successful, ones that are successful for a while, and then they ultimately fail. And so what I want to do is inform and kind of educate you on what is kind of out there in the research, but then also what personal experience has been in our practice and in our past practice when we were out in California, which we saw a lot of people before they went off to have surgeries, and we were actually having a lot of surgeons who were sending their patients to us to double check and see if they actually thought they were good candidates for surgery. And so the rule of thumb to go by is sometimes surgery is necessary. But if it is not necessary, meaning that it could be fixed by reestablishing the connection and allowing the body to heal itself and allowing those joints to be relieved of any pressure, and your body can, and that was the trick, and that was what would allow your body to heal, then that means that surgery would not be a benefit to you. So a lot of times what happens is people jump into surgery before they give themselves the chance for their body to heal without the surgery. And that is almost always going to be a bad outcome in surgical intervention, because by the very nature, surgery wasn't it wasn't a surgical type of a problem. It was a problem that could have been healed completely naturally, yet surgery was the tool that was used. So if you use surgery as a tool for something that's not wasn't the right tool, then how effective is it going to be? It's going to be very, very dangerous to go through that, because one, anyone who's considering spinal surgery, you've been through it before, you realize how serious of an ordeal it is. It's a big insult to the body, and you're dealing with sensitive spinal structures, and things can go wrong. And I don't want to scare anybody who's going that direction, but I mean, it's a big deal. It is a big deal. It's not a surgery that should be taken lightly. It's very common. There's a lot of people that wind up in that boat where they think that they need surgery. So my biggest push for you is that if you have not considered chiropractic, and not even considered it, if you have not been through at least several months of getting adjusted regularly, then, and before going the surgical route, then cancel the surgery now. Try chiropractic first. The thing is, I see so many people who, they think for sure that the only thing that's going to fix them is surgery, because the pain can be unbearable. When you're dealing with severe nerve irritation, where your sciatic nerve, which is the pain, goes down your leg into your butt, all the way down to your foot, it can cause numbness, tingling, severe back pain, severe pain on the leg. When you get someone who's hot like that, I guarantee you they'll sign whatever they need to sign to get out of pain as soon as possible, because it is excruciating. Unfortunately, that emotional knee-jerk decision can wind up costing you for the rest of your life if you go through and do a surgery that was unnecessary, but you were willing to do whatever it takes. A lot of times surgeons aren't on board with chiropractic, I'll be quite honest with you. They don't really know what it is that we do, and they're not taught or educated about chiropractic when they're going through medical school. So to them, they're like, yeah, it's probably not going to be that effective. And they just don't care, right? They are there to do a job, and their job is to do their best to get you out of pain. And if it looks like it's a possible surgical fix, they're going to go for it. Maybe they'll send you to physical therapy first if they're on top of their game, but physical therapy really doesn't do a lot for serious disc injuries. And so they know that, okay, well, go through the surgery or go through physical therapy for a month or two, and if it doesn't work, then we're going to go ahead and we're going to cut you open and do the surgery. So chiropractic doesn't even pop into their mind or register that this is something that is completely in our wheelhouse to fix. But like I said, it doesn't work for everybody, but you want to rule out that chiropractic will work for you. You want to make sure that if you're going to surgery, that you absolutely have tried chiropractic and not just, I went for a few weeks and it didn't get better. That is not the way that it's going to work. You need to at least commit a solid 2 months of regular adjustments, usually 3 times a week when it's that severe, depending on the severity of the people that we see. Sometimes we'll see them literally four times a week, depending on how bad it actually is, because you just need that time and that repetition in order to take the pressure off the nerves, allow the body to start to heal itself. And when it's that bad, I mean, it's been going on for a long time, and you finally hit something where the straw that broke the camel's back, and now you're in a pure crisis mode. So we do see this a lot, and I want to make sure that I can save you from a surgery that is unnecessary. And the best way, you just literally have to do it. You have to just go in, get adjusted, get chiropractic care. The type of care that we do, there's no popping, twisting, or cracking. We do align the bones. They do get moved back into place, but we use your own body's nervous system to make that switch for you. So the muscles that are pulling bones out of place, we get them to start to change on their own so that your body can start to get back in the position that it needs to be in to restore that proper healing energy that's literally coming from your brain going into your body. And we'll see phenomenal changes. And a lot of times people get scared because they think that if they go to a chiropractor that they're going to put them on a table and they're going to twist them, and they're already in complete, very severe pain before you come into the office, and you're like, I don't want anyone twisting me or doing anything because I am in such bad pain. That's the last thing that sounds, it's the furthest thing from appealing. Our office, we don't do that. We use a tool. I'll show you what the tool actually looks like. It looks like this. It cocks and releases, and it goes at, I've got it in my hand right here, hold on. So it goes at 1/10,000th of a second. What that does is that shifts the bones back into place by establishing a reflex that goes to the brain. Brain controls muscles, remember that, and those muscles will start to relax and figure out where you need to be, and it's like a reset to that joint. And when we reset that joint, it changes how everything is starting to communicate. And just like anything, when the way the brain operates is by learning. So that's why you have to do this repeatedly over and over and over again until at some point your brain learns that, oh, we need to reestablish this connection better. And then that's how things start to shift and they start to change. So our results have been very, very good. I'm sure there's lots of chiropractors out there who have gotten really good results with people that are scheduled for surgeries. Have many people cancel the surgeries. So don't be bullied into thinking that that's your only option either, because a lot of times doctors can be very aggressive with their recommendations and saying things like, you have to do this now. There are certain situations where that is where they're right, and that's an emergency situation where you've lost bowel control or bladder control. In that situation, there's not anything that I'm going to be able to do for you or that we're going to be able to do here with Ignite Chiropractic. That's, you go to the ER at that point. That is an emergency surgery situation, but that is very, very rare that you're in that situation. I hope for your sake that you're not. All other situations, as painful as it is, as much as you can tolerate that pain for just a little bit longer, get a second opinion, come to a neurologically based chiropractor, let them check you out, and so that you can have that true second opinion. Go to someone that you trust. You got to trust that they know what they're doing, and you'll know just based on their comfort level. Because some people say, "Oh, I don't take cases like that." Some chiropractors get really squeamish because they don't have the tools necessary to be able to have success with that. So you want to make sure that when you're having that conversation that that they know that they can do something to help you and willing to dive in and do whatever it takes to get you back to feeling great without having to go through surgery. So those are the big topics I wanted to hit on today about spinal surgeries, and that goes not just for your low back, that also goes for your neck. So if you're having considered neck surgery, everything I just said applies to you as well. So I hope you have an awesome day. Send this to anyone who you know who might be considering surgery and they're looking for different options. Again, if you're in the Northwest Arkansas area, we invite you to come into our practice, and we'd be happy to do a consultation with you to go over what your options really are. And I think we'd be able to help you and do something for you. And it's worth a shot for sure before you go on under the knife. So I hope you have an awesome rest of your day. Again, this is Dr. Lee Horan with Ignite Chiropractic, and I will talk to you soon.